All right, everybody, I'm going to bring this Health and Human Services Committee meeting to order. It is March 18th, 2025 at 3:46 p.m. We're going to start off with Social Services. Commissioner Gibson.
Hello, Commissioner.
Looks how are you? Good to see you. Probably those best sweater. Yeah. I get cold up in New
Got
York.
the best sweaters. You guys get the best sweaters.
All right, just a couple of things today. Requesting to fill one caseworker position.
Do I have a motion?
I'll move it.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
All right, and request to enter into an agreement with the Capital District Home
Move it.
Care.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thanks very much. Just very quickly, just put it open to the floor. Any questions on any of these stats? As you can see, there's no let up on the homeless issue there. It's talking, I talk to the state now pretty much weekly to make sure that any of these programs that could get affected, is there anything that they're aware of that's coming at this point? And there is not. So we're just sort of waiting to see what, if anything, does occur from that level. So
Is this section 4 funding? We were asked this earlier and we didn't have an answer to that.
I do know that section. This comes
Okay.
out of safety.
Okay.
And, but, as we look at it, there's concern on our end because you can see the number of recipients that we have and, the max is not all that high to begin with. So if there's some sort of adjustment, it's gonna, we'll figure it out. It's gonna hit us. So we got our eyes on all of that.
When does the code blue
Yeah.
housing expire?
So that's gonna run through the end of April.
And that's still full capacity.
Yeah. Yeah.
And I've forgotten, are those numbers in these numbers or are those additional numbers?
No, they're in the homeless number. We're counting.
No, they actively being transitioned.
But we do the very best that we can, yeah. Probably not to the extent that folks in the Galvin would be just on readiness alone.
Okay.
Because remember, over at the Mission Inn, the income deficits there and the like, so, but, it's been much better because they are ready to transition over the program.
Right.
And in a manner that we would not have been probably if we weren't having day-to-day contact with them. So,
Because of the way that the state works, if you have, correct me if I'm wrong, please,
Mhm.
husband, wife, kids, they don't have to work, correct? Is that basically the correct statement? Or if they hit a certain threshold, then they would lose their benefits, correct?
so specifically the SNAP.
Just
Is that
in
what you
general,
wanna-
we had talked about that the last time, that if you have, individuals in, that the county's paying for, the federal government, whatever, that if those individuals work and make too much money, then they lose their services, correct?
Depending on circumstances,
Okay.
because if there are children, there are
That's what I say,
also,
if there are children,
yes,
yeah.
there's different waivers for that as well.
So my question is if those regulations weren't so, to me, I don't think those are correct, but if those weren't that way, would there be more people transitioning?
Well, out of necessity.
Yeah.
Yeah,
That's true. Right.
yeah. I mean, I
This is our ultimate goal.
Well, I think that
Well, that's, I think, all of our goal. I think back to his point, and, I just think the system is, we just keep people in these positions and we're not transitioning, which is the goal, right? I'd rather see a supplement than exactly pay 100% of it, but anyway, that's the way the system is.
yeah, I mean, a lot of that's dating now to COVID when it was absolutely necessary.
Right.
And it is connected with our children and family services cases.
Sure.
So, to be honest with you, then you shift focus when you have children involved, then you're hyper focused on their nutrition and their safety. But, and I stay out of that higher level, you know, I'll leave that to folks like yourself and any other elected officials, but I take, you know, the only thing that concerns me is being caught flat-footed. So some kind of change comes at me really fast. I'm not ready to adjust to it, which is why we stay so in contact with the state, but, so,
It
you
doesn't
know,
turn into a local fund, it becomes ours.
well, we'll be sitting around trying to figure out,
Yeah.
from the local level, what we're going
Because we don't
to
want
do.
to turn that, you know, right?
So the, section 8 right now, do we know how many people are on the wait list and what the length of time is?
Well, it's lengthy.
Okay.
Supervisor Martin and I, we had a meeting about 2 weeks ago. We could tell you, and it's been growing. Do I see relief in sight? Probably not until there's a little more housing stock available in the whole region. That's a region-wide thing. But certainly we're affected by that.
So the other question I wanted to ask you is, I know a lot of people are on the wait list because they can't find housing. If we have an 82-year-old couple that's been evicted, and if I can find local housing for them, they will need assistance. Could they move up the list, or would they have to start at the bottom?
Well, so two things there. If they're not on a list,
They're not yet.
but you found an apartment,
I think I have.
then the list doesn't matter. Because you have to, and yeah, we can
We can
then
expedite
provide.
the next.
Yeah, we can
Okay.
get first
Okay.
months of security. The list matters when, you know, the list is just an aid to try to find
Housing.
housing.
Right.
We have 4 beds at assisted living. I don't know if there's any appropriate for.
Well, if there are, actually, there might be one. You might be getting a call. Actually, because we are stepping someone down from skilled, so they probably have a call.
Okay.
Okay.
And the county has a contingency fund, right?
We have a man from Sawbreeze that's there through their homeless program. And the homeless program actually pays.
Yeah, we've
It's
done
so-
that, remember? We've done that in the past.
Yeah.
We would do that, but I think we actually have a client ready to step down from skilled to a more assisted, so.
Perfect, okay.
uh,
But I was just saying, no, the county has a contingency fund, right? Matt?
What do
I
you
thought
need
we should.
For contingency for,
for what?
we did away with our contingency account
Okay,
quite a few years ago.
okay. I thought it was, because I was gonna ask that if the,
budget.
I'm sorry.
50 grand, maybe 100 grand in the contingency fund.
Okay, I stand.
yeah, I thought I scanned it. I thought I seen it. I just wanted to know if the social services has that for unexpected expenses and things like that.
No, I mean, look, we'll spend what we have to spend, but I've got to come here to the table and
Yep.
say, look, we're gonna go over budget because, and I've never had any pushback.
Oh, no, I was thinking about something else. I should, we could time to ask that.
Yeah, I think, you know, what message that I send to the state is the quicker you can get me notice, the quicker I can provide notice. Because there's just no way unless we're all sitting at the table that we're gonna be able to plan for it. So, you know, they're watching for me up there. I'm gonna put it out.
Any further questions for Commissioner Gibson?
Thanks,
Thank you, sir.
folks.
Thank you.
Up next, Director Grandinetti, Youth Development.
Yeah, so we got a couple updates. The SWIMS program for the towns and the city. We received the contract back from the Department of State. I sent it down to Jim. Jim's gonna send it up to the county attorney and get Chairman Morrell to sign it. So it looks like we're coming to an end for that.
That should make hiring lifeguards much easier. Thank you.
And our 24-25 year program allocation. Our resource allocation plan has been approved by the state and jumped in my phone as well. The youth leadership banquet, we have pretty much every school participating. I think we have like 14 nominees and we're just waiting on 11. And then we should have a full nominee set for the banquet. Huracan Valley's participating this year. We have a couple other independent folks that are gonna participate as well. I was able to confirm for Canning and Stockport for the, your town community days, and I gotta get back with Supervisor for Germantown.
Thank you. A quick question on that, there that you brought up, it's for Brenda. Was that paid for?
Yes. Yeah.
Okay, will you need assistance with transportation?
Yes, please.
We'll arrange for that.
Thank you.
Any questions for Director Grandin?
Just a thank you.
Thank you.
Thank you, sir. Department of Health. As always, doing a remarkable job of stepping in.
I can't wait.
Waiting for your fearless leader to
You
come
know,
back. Rob.
actually, she sent me a beautiful little picture today because Ophelia's 1 month old today. So we have a few things on here, starting with the wastewater disposal policy. So, reading away. Whereas the Columbia County Department of Health has drafted an on-site waste facilities management and disposal policy to supplement the New York State Sanitary Code to address the needs of Columbia County. And whereas said policy has been drafted in cooperation with the Columbia County engineer, we'd like to resolve that the Columbia County Sanitary Code, Chapter 5, on-site waste facilities management and disposal be approved.
Mr.
And
Chairman,
be adopted by local law with public hearing, if I may interject an amendment, to be scheduled at county full board on April 9th, 2025. Does that sound amenable to
that
everyone?
sounds amendable to me, and I would make that motion.
Do I have a second?
it.
I'll second.
Further discussion?
I just think this is where people would expect to find this, so I think
Yeah.
it's being transparent and informative to put it, to do it, to
Yeah.
follow this process. Thank you.
Did confirm that with the county attorney and the county engineer, that that is the process that they would like to see it adopted at because of enforcement of it, so
And Maggie,
just cleans it up.
Maggie unfortunately had a doctor's appointment this afternoon, and I had brought her along because she's gonna need that information so that we go forward with her full
Yeah.
knowledge.
And never talked to Rob, and I did talk to Rob this morning, Fitson, and saying he would work with you to get that, you know, it's just, it's the same policy, we're not changing any wording, but just make it a local law, that's all.
All in favor?
Aye.
Opposed? Carried.
The next is for the Public Health Director requesting authorization to award a bid for the Healthy Neighborhoods Program to A. Phillips Hardware for 1 year with an option for 2 one-year extensions. This is where we get our supplies for the Healthy Neighborhoods program.
Do I have a motion?
I'll move it.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And as we discussed last time, we had a service coordinator who left us actually on March 7th, and we need to fill that position.
I'll move it. I'll second it.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then we need to transfer some funds to get the budget balanced. Voucher to reimburse for personnel services in the 2024 grant, and these personnel expenses should be reflected in an account associated with the corresponding grant. So they're going to be moving the funds to the appropriate personnel line.
Do I have a motion?
I'll move it.
Second.
Further discussion?
Just one question. Are these funds being accrued for 2025 or are these funds, are we revising the 2024 budget?
It's 2024,
Okay, just one.
fiscal year 2024.
Okay.
Jim, have you reviewed all this?
Yep.
Okay.
All in favor?
Aye.
Opposed? Carried.
This is for the Healthcare Consortium for implementation of the 2025-2030 Community Health Improvement Plan. So whereas the Community Health Improvement Plan is under development, and in previous years, the Health Department has contracted with Columbia County Healthcare Consortium for the implementation of the plan, with focus areas such as obesity prevention, substance use disorder, communicable disease. We'd like to resolve that the chairman of the Board of Supervisors authorizes the contract with the Columbia County Healthcare Consortium for implementation of the Community Health Improvement Plan for 2025 for Schedule A in the amount not to exceed $5,000.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And the early intervention and preschool program, we've talked previously about the fact that it's hard to get providers. And we have contracted with Jessica Flanagan, who's an OT, and to administer services to eligible preschool children to fulfill the program requirements.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you very much.
Thank you.
Thank you.
Thank you.
Oh, wait,
Authorization accepted, right?
modified budget?
Oh, I got another one.
Yeah.
Did I skip one?
That's $134,000.
I'll make that motion.
Oh, no, that's the water.
Accept drinking water and it's been granted.
Hang on.
Further discussion on accepting all that money? All in favor?
Where did you miss the water?
Carried.
If I'd seen Grant, I would have said it a lot quicker. If Ray was here, he would have said.
The
it.
very last resolution.
Did I miss anything else? No. Okay, thank you. Thank you.
Thanks for ending on a strong note.
That's right. Yeah, we're all about money.
Save the best for last.
Can I accept this money? Please do.
All right, stepping up next, Office of the Aging, Ms. Benvenuto.
Hello, hello.
Hello.
You're not gonna hear a whole lot from me today, because I brought friends. First thing for you is, request to fill our vacant cook position.
Second.
Further discussion? All in favor?
Aye.
Opposed?
Thank you very much. The next is mostly just to give you, just a follow-up from previous discussions, to the proposed changes to our advisory council, kind of how we're running things. It wasn't last meeting, maybe 2 or 3 meetings ago, we had talked about, increase in communication via subcommittee, et cetera. So I did attach it here. I just wanted to give you an update. We'll be going over this, tomorrow at tomorrow's Wednesday at our meeting. So it kind of breaks down what we're looking at for the various, subcommittees. So it will give you an idea of what your representatives from each town are going to be asked to do going forward. So it still hasn't been officially put into place, but I just wanted to give you an update there. And if there's no questions on that, I will introduce our new registered dietitians, Lynn Hart and Juanita Bryant, because I wanted to have everyone meet them as they're coming on to help with the nutrition program. And there's only 2 seats, so I'll just awkwardly stand behind. So if you'll recall, Ellen, who was our dietitian for, off the top of my head, I don't remember how many years now, but she just recently retired in December. And then we brought on Bryant Nutrition. So I'll just kind of. Thank you.
Welcome.
Welcome.
So thank you all. It's nice to be here and meet you all. Lynn and I have worked together many years and we are very supportive of this program. I actually was here back in the 90s. I worked with Mary Richardson. I don't know if anyone remembers back then. And left for an educational program. Since that point in time, I've always been a strong supporter of the Office for the Aging, specifically the nutrition program. I've worked in Greene County, Office for the Aging, and most recently down in Ulster County. It's a great program. It is the oversight from the state, really helps, I think, keeping the focus on good, healthy eating, on sanitation, education. And I've actually started this month, did a few programs in the county. I haven't been to all the sites yet. Many of them are new since I was here in the 90s. But I was actually in Elizabeth, the town of Livingston. Where else have I been? Galatia, Stuyvesant Falls. Pardon? Canaan, yeah. It was so nice to meet so many of the new, participants and doing an educational program and enjoying the meal there, getting to see what's being served and hearing how much the people enjoy it and the companionship there as well. So I just am glad to be able to introduce myself and hopefully get to meet all of you a little bit more as we get to know more about the towns and the people there.
So I'm Lynn Hart. Many of you might remember me. I still work for the Columbia County Sheriff's Department. I've been a dietitian for 33 years. I worked for New York State Office for the Aging for 9 years. From just until 2019, I left. I'm very happy to be a part of this program. I began my career at Dutchess County Office for the Aging, so it has been a nice opportunity for me to return to my roots. I oversaw 30 of the 59 counties nutrition programs in the state of New York. And actually, I was your surveyor at one time years ago, and Columbia County Office for the Aging nutrition program is very near and dear to me. It's an excellent run program. I've always been proud to live here, serve and service the county. Currently, my piece of this is, because I still do work for full-time for the state, my piece is it's actually a large piece, but I'm working on the menus. I'm working on tasting all of the foods. I am working on, we're going to work on contracts. One of the things I'm working on is called the Executive Order 32, was put out by Governor Hochul, where we want to use New York products in our counties, in any state agency, and within that, our counties. Just our goals, first year 2023 is 5% of New York product. Year 2, 2024 was 15%. 2025, which is this year, we want to shoot for 20% of New York product in our programs. 2026, we go up to 25%, and 2027, it's 30%. So, and it's a heartbeat, but what we would like to do is involve, things like local farms. We want to develop contracts. We'd like to make sure we use New York milk. We're not really great wheat growers here, but a lot of produce that I think that we'd like to reintroduce into our programs. Other things, just little things. Tomorrow I'm going to be at the Philmont site very early. We're going to have a meeting with the cook staff and the new nutrition coordinator. Is that our nutrition program coordinator, Amanda? And so what we're looking to, ramp up these menus. I've started the process of reviewing all the feedback from the participants. So far, we've gotten a lot of good feedback. We're making some changes to the menu, little things, we talked about even, I know we were using an instant potato product, and now we're not. We are using all whole potatoes. We have plenty to go around in the county. Last week I attended the Livingston, Elizaville site. And I have to tell you, coming from a very Irish family, that was the best corned beef and cabbage I have ever had in my entire life. And I did confess to my Irish mother. But anyway,
She has since the zone.
I am cut out. But anyway, I think the program has a lot to offer. And the person I ate was a 103-year-old gentleman that said, this menu goes to number one. He goes, the next time, bring that with you. So I certainly can't claim to have cooked that. But anyway, I'm going to be quizzing them tomorrow to find out how they made that so delicious.
So I thought you were going to say your mom wanted you to wrangle her an invitation.
I know, I told her she should come. I don't know if you have any questions for either one of us or me. One of the things that we follow, it used to be called the 90 PI 26, and now it's called the 19 PI 26. I was a part of authoring this. It was a labor of love, but we have to follow certain regulations in the state with regard to nutrition. It's called the dietary reference intakes, the dietary guidelines for Americans. And it all encompasses things like sodium. So some of our meals, you know, like you might say, well, that needs a lot of salt. And to get our funding, we actually have to follow certain guidelines, milligrams, things like that, as far as sodium, fat, calories. We also follow the food service establishment guidelines, which I'm sure our Department of Health knows over here, 14.1 for the food service established guidelines, which have to do with temperatures. So you'll see us out there temping foods all the time. We do a lot of that. So there's even right down to how we deliver the food has to be, you know, that hot food has to be 130 degrees. The cold food has to be 40 or under. So we're always, you know, that's why, you know, we spend money on these containers. We spend money, you know, and time-wise, we got to get the food there. I'm very impressed to the places I have been so far that the temperatures are really holding nicely on the products. I mean, they were all in that limit. So I have to say I was very impressed with that. But I could go on forever and ever, so I'm not going to, but I invite you to look at these. This is kind of like the basis of our program and what we have to do. The regulations are elsewhere in the state, but this is actually what that is the program instruction. So it goes through every area of the program, eligibility, what we have to follow. So it's
Oh, we welcome you both on, and thank you for all your work.
I've worked with Juanita for years and years, as well as Mary Richardson in nursing capacity. So yeah, long term. And so we know about the regulations, and I know all about her strictness to nutrition.
Great.
She was very good with it, and never worked with you, but very well versed in your educational expertise there. So, yeah, very well.
Best of luck in trying to converge nutritious with delicious.
There you go.
So two
So
really
far,
quick
so good.
questions.
Sure.
My senior would really like for us to consider a gluten-free meal because we have a number of gluten-free constituents. And the other thing is the executive order number 32 about using a certain percentage of New York farm products. Is there any funding associated with that, or are we paying the additional upcharge for
There's
those?
not funding.
Fall beyond where we are.
Yeah.
Yeah,
Right.
it's just, yeah,
How is that?
it
I mean,
should not be more
Is
expensive.
it by pound, by dollar spent?
It's by dollar spent. So, you know, you take your entire, like say you have a Cisco bill, you know, you want to, well, that's actually, they're not really a great example
No.
because they're getting food all over the place, as we're finding in many state agencies are finding that to be.
So you're reaching out to local farms?
So that's what I would like to
Directly
do
or-
here, yes, and develop contracts, you know, make sure I know we get our milk, it's a New York milk, we should get New York milk, so, you know, and
Just plenty.
yeah, we have plenty of milk here. But,
Dairy's
you know,
easy,
meat
yeah.
is kind of tough, so we might not be, you know, that could get very expensive, that does, because that's very smart, but not produce. We can,
There's a lot of.
there's a lot of
in there.
A lot of
produce.
produce and
Potatoes, et cetera.
Potatoes,
you can use
carrots.
dairy.
And there are a lot of, these small, farm stands that are capable of supplying much larger quantities than
Yeah.
just a bushel of
Yes.
this and a bushel of that.
Yeah, especially in the summer.
Thank you.
Okay, so, all right,
Thank you both very much.
Thank
very
you.
much.
Stepping up next, Director Almasi. Human Services.
Hi, everybody. Good afternoon. Nice to see all of you. Sorry I missed you last month. It's good to be back. Not too many
You brought the nice weather
resolutions.
and everything. Good for you.
I did. I'm personally responsible.
Thank you.
I appreciate that confidence.
Yeah, well, thank you very much. I appreciate it.
Anything I can do
You're gonna take credit for today.
Tomorrow.
Friday might not be good, but.
not to digress, but I heard 70 tomorrow.
That's right.
Yeah, maybe tomorrow.
I'll believe it when I see it.
Yeah.
And then,
1 to
then it
3.
snow again this weekend.
Please, tell me. Good. All right, let's talk resolutions.
Okay.
One financial resolution. This is basically requesting your permission to receive state aid.
Move it.
Second.
Okay.
Further discussion? All in favor?
Aye.
Opposed? Carried.
General resolution number 1 speaks to contract with Healthy Alliance. This refers to the 1115 waiver and our desire, I don't know if you had a chance to read my report for the, where I elaborate on what the 1115 waiver is. If you'd like to, I can speak on that at this time to give you a little bit of a background. But basically, we're looking to contract with Healthy Alliance, that is the entity that works with Columbia County to operationalize portions of the 1115 waiver. The piece that we're looking to contract with them for specifically is to do social determinants of health screenings, which we already do. There is some potential to get a small amount of reimbursement for this work that we're already doing, so why not? There are many other facets to the 1115 waiver, including navigation services, transportation services, and then there is a desire to work with community-based organizations around healthier nutrition, improving people's quality of life in terms of housing and things like that. Those would not be things that the Department of Human Services would be participating in. So this is just asking for your support to participate in a contract with them.
I'll move it.
Have a second?
I just want to clarification, but what are you waiving? You,
Waiving.
and the other, it's a waiver, so that opts you out of something.
Right. The 1115 waiver refers to the law, as I understand it, that allows you to modify the Medicaid law.
Okay.
So this is New York State's latest attempt to improve Medicaid, make it more efficient, make it more effective in terms of how those dollars are used, and so on and so forth. They've had various attempts at this prior to now. This is their second or third, I believe, waiver. They call it the 1115 waiver.
Further discussion? All in favor?
Aye.
Opposed? Carried.
I ask for your support to contract with Quest Diagnostics. Quest Diagnostics is a laboratory. The Department of Human Services is interested in doing toxicology screening selectively and as a therapeutic tool with the folks that we serve. For various reasons, we want to make sure that if they're using illicit substances, we know what they are. We want to make sure that if we're prescribing, we know that that medicine is in fact being taken by the individual and not being diverted. And there's a host of other reasons. So Quest Diagnostics can offer us this service. There wouldn't be any charge to the county, the individual insurance, just like that.
So would you have a policy about who's tested?
Yes.
Okay.
Yes.
And that policy already exists or is in place?
I wrote the policy many moons ago when I first started. However, we're dusting that policy off and updating
Taking a
it.
look, fresh look.
Yes, exactly. It's been so many years.
Thank you.
What happened is when I first came on board with the county, it was not in my current capacity. It was as the dual recovery coordinator, and my predecessor, Michael Cole, asked me to draft it. At that time, which was a dozen or so years ago, we made good progress in the area. Along came COVID, massive workforce shift. So a lot of people have forgotten that we even have the ability to do this, including our prescribers, our social workers, our caseworkers, et cetera. So we're going back to it. We're reintroducing the whole floor to this, reintroducing our clients to the fact that this is something that they could be asked to participate in, et cetera, et cetera.
Do they have to get permission at the time they sign up for services? Do they have to
There is a
pre-assess it?
communication that they're offered in the intake packet. So when they're coming in for the initial visit, they're aware that
This
we
could
do
happen.
this as a practice that we have opted.
And would services be contingent on passing or failing a test?
No, absolutely
Okay.
not. No, no, it's a therapeutic tool.
Right, just wanted to be sure.
This isn't like, a gotcha moment. This is to make sure that we are helping the person.
It's knowing what you're treating.
Yeah, thank you.
All in favor?
Aye.
Opposed? Carried.
The third general resolution is to contract with a commercial insurance company known as Highmark. So we're just asking that you support us continuing to contract with that commercial payer.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
fourth and final general resolution, is for us to work with the New York State Office of Mental Health and their latest quality improvement collaborative, I think it is. What does it say there?
Yeah.
What this means is that we participate in the collaborative, and what we get for that is an enhanced Medicaid rate, so slightly higher Medicaid reimbursement rate for doing so. We've gone through several rounds of this. This latest round, we've chosen engagement, reduction of wait lists, things like that. Now, I just want to remind you, we don't have a wait list, and I think we're doing a fine job of engaging, but the other choices weren't as applicable to us, so we went with this. And we feel we can always improve in terms of how we engage the general public in our services and letting them know that we exist and that they can access us.
Is this kind of like the Good Housekeeping seal of approval, that you'll be more competitive for other funding? Or is it?
No, I don't think so. I think it's just, the way I understand it is OMH has historically been, the lead on rolling these out to the counties, and if you participate, the benefit, the reward is a slightly higher Medicaid reimbursement. It's not monumental, Supervisor Adams. It's
Every penny counts.
every penny counts, exactly, which is why we're doing that social determinants of health screening for the 1115 waiver. I mean, they're reimbursing $17 per screen. And if another provider did the screen and we do it, we don't get anything. We're doing it because it's the right thing to do. It's a good thing to do. It's good to understand where a person stands in terms of that social determinants of health assessment and screening. And, we're doing this quality improvement collaborative for many of the same reasons.
Hold it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
I don't know if you want to look at it. We did include an overtime report. We've hardly touched, our budget. I think we've used all of $605.86, leaving us with a balance of $11,394.14. So we're good in terms of our overtime. I see that we have my report in front of you. Just a couple of things I'd like to share with you quickly. The short-term transitional residents, the update there is that Gateway was awarded the RFP from the state. They are well on their way to, operationalizing that, meaning they're in talks with the other members of the Wellness Hub. That would be Rupco and Greenberger, in terms of how they can get a portion of the Wellness Hub to site the 12 or 14 units of short-term transitional residences that they were awarded by the state. So that's on its way and moving in a nice direction. Oxford House is also up and running. I believe I've talked about that and shared that in my previous reports. They do have 2 vacancies. We're doing everything we can to fill those 2 remaining beds, but in some cases people come and they stay for a longer period of time. In some instances they come and they leave quite quickly, realizing that it's not for them. So that bed becomes available. But Jamonte Johnson is doing a wonderful job as the coordinator in terms of getting together with community providers, getting the word out there, etc. And, I'm confident that we'll have a full house soon. Resource guide. This is a big one. My dual recovery coordinator, John Cahill, was tasked by me to create a resource guide. Now, we've had resource guides in the past that have listed and outlined all things behavioral health. This one covers both Columbia and Greene County. And the wow factor here is that it is searchable with artificial intelligence. Previously, these were hard copy paper documents that were outdated as soon as they were printed. It's always the challenge with something like this. So the beauty of this is, sure, it can be in a PDF form that can be printed. I believe it's all of 130 pages, but having it now be electronic and searchable with the help of AI is really a huge step in the right direction, I believe. Columbia County MIS was very helpful in regard to that, so I want to give them credit, as were a lot of the nonprofits that pitched in and helped out JPK Health. And you can find it on our website. It's prominently displayed. There's a QR code there that gets you to it as well. So just really excited that we have that. And providers have given me feedback and told me that they've already used it and they really like it.
It's easy to navigate. I did some navigation on it yesterday.
Oh, I'm so glad to hear that. Thank you. I mean, it's not perfect and I want feedback because if the AI goes rogue and you know, brings you
Still
to,
need to be
I was
human.
gonna say, that's the first positive thing I've heard about AI.
Yeah.
Maybe I'm reading the wrong thing.
I, you know, Sharon Collins, my jury is out as well. It has strengths, it has weaknesses. It's not perfect. Much like us humans, I guess. But, you know, it's a tool. And then the last thing I'll share with you that was in my report, there's other things, but I just want to highlight that the Article 31 clinic, the Columbia County Mental Health Center, did in fact have its recertification visit 1 year late by the state. We were prepared nonetheless, and the official word is not in yet because they haven't prepared their report to us. When I get it, I will share it. But on the quiet, we were told that we would be getting a 3-year recertification, which is the maximum. So I'm very proud of that. They were particularly pleased with the level of documentation and also the atmosphere on the floor. If you haven't visited the 3rd floor over at 325, I encourage you to. Again, with the, I don't want to say this, the new faces and bodies that we have, you know, due to the transition, the workforce transition, they've brought enthusiasm, they've brought, not that we didn't have joy on the floor previously, but there's an energy, there's a happiness. People are decorating, you know, whether it's their offices in a way that they've never done before or their doorways, the waiting room. They were struck by the fact that, you know, how welcoming and warm it was. And I'm not talking about the temperature. I'm talking about just the attitude, the welcome that they got from our receptionists, the 2 ladies that sit at the front window. I couldn't be more proud of that because they are the right people. They are the face of the department and they welcome the general public in a really, really nice way.
Not the temperature, but the atmosphere.
That's right.
Congratulations.
Yes, thank you for that. And then I did have one agenda item to talk with you, which I have forwarded materials, albeit a little late, to Kelly, who can then share them with you after this conversation. But there's an organization that is providing vending machines for naloxone, or otherwise known as Narcan, xylazine, and fentanyl test strips. We have one of these in our county already. If you're not aware, it's located over at the Mental Health Association of Columbia and Green. I'm blanking on the street that they're on. Help me, somebody. Union, yeah, 713 Union, I think it is. So it's located right outside of their building, which is great, but it's kind of off the beaten path. So this organization known as Matters will pay for the actual vending machine. They provide the products free. They will even pay for the electrical connection and the pouring of the slab, the level concrete slab that is required. So what I wanted to do today was just talk with you about this concept, this idea of having another one of those vending machine dispensing devices located in Columbia County, and what your thoughts were as to what might be a good location. Again, I think the one at the Mental Health Association is fine, but if you know where they are, you know that that's not a main thoroughfare. It's not a high pedestrian or vehicle traffic kind of spot.
Does Matters have an app? Can you go on your phone and find out where those machines are
I
located?
believe they do, yes.
That's a great.
Yeah. Yeah.
Access.
In the material that I shared with Kelly, there is a photo that shows you all the locations throughout the state or the region. Oh, thanks, Kelly. So that's what it looks like.
Where were you thinking, Dan?
Well, I'm going to hold off answering that. Why don't you tell me a few ideas? It was suggested to me that I get ideas from you. Yes, I have an idea. I do, but does anybody have an idea that they would like to propose?
Are you asking in the city of Hudson, or does it have to be anywhere?
Inside, I would think.
It could, yeah, I mean, I would say we have one in the city of Hudson, right?
We do. We could have multiples. I mean, again, this is provided free of charge. The way it works, and it's all in this description. I don't know how much into the weeds you want me to get, but basically the company that builds it, the actual machine, when it's ready, they'll send us an invoice. We take that invoice, we send it to Matters. Matters cuts the check and pays the manufacturer.
And who pays for the product inside of it?
The product is sent free to
Sent
us.
free, okay.
Yes.
Have you talked to Carl Quinn? Is he somebody that we might have an opinion about where they should go?
I
Because of the
have
positions he
it.
serves?
Carl is, he's with the Hudson Behavioral Health Court now.
I didn't know that.
Yes,
Okay.
he's no longer with Greener Pathways, but
Okay.
I can talk to Bob, who is the new Carl at Greener Pathways. But I'll spill it. To be honest, I was thinking of the Department of Human Services building.
That's my thought.
It's literally a step away from Warren Street, which we know is extremely busy. I mean, I've been up here on the weekends occasionally. I live in Ulster County, but I've been in a whole different world up here on the weekends. The amount of foot traffic is remarkable. We also get a lot of people in the building that could benefit from this. We have smaller boxes, like about this big, set up in the restrooms and in our lobby, and we're replenishing the material in there regularly. So I think if there was a vending machine outside that could be accessed 24/7, that would be something. I also pitched it, again, this is in Hudson, so I'm interested in ideas outside of Hudson proper.
I was just, are there any other neighborhoods that,
I think Philmont is one that comes to mind.
That's one that came to mind.
Again, I know could be potentially controversial, because what are the optics? Somebody could say, listen, you want to put that in my neighborhood? Are you trying to say there's a drug problem? I'm not trying to say anything in that regard. I'm just trying to put life-saving materials in people's hands should they choose or want to, activate the vending machine and get a Narcan kit should they need it, or if they happen to be an individual that uses or dabbles.
Is there any type of alert if there is a vending machine is activated for emergency services to respond, or would that just be?
Some people might do it prophylactically just to have one at home.
Yes,
Well, that's what I just,
yes.
I didn't know. if it
I didn't
would-
follow your question about emergency.
No, would it
Trigger.
automatically trigger?
Oh, no,
response?
EMS response. No,
okay,
not at all.
That's what I.
And how does somebody access the machine?
They put in their zip code, and I think they use. I got the presentation like a month or so ago, Rob, so I'm a little fuzzy on that, but there's a way. I think there's an app. You go on the app, you put in. You don't have to give like your name or anything like that. You can do this completely anonymously. You put in your zip code. That's the one thing I do remember, because they want to know, who from what geographic location is accessing it, so that data can help them, kind of market where they should put
The next
machine, right?
And
Is
word
there
of
any
word of
liability
mouth
on
will
the
get out.
county's behalf of this?
How many places in the county have AA meetings? I know our town hall sponsors AA meetings. I've been where you have people that might be susceptible to.
Yeah, it's changed, Supervisor Adams, in that a lot of the 12-step fellowship, as I understand it, has gone virtual. So there used to be several congregations, churches that
Right.
would allow, but then even the churches started to charge, I heard. And then, they charged because their insurance went up as a result of hosting these,
I've never declared it
Non-faith.
with my insurance company.
non-faith-based type meetings. So they had to pass it on. And so that incentivized the 12-step community to go virtual, which is debatable as to whether
Right.
that's ideal or not.
Well, ours went virtual during COVID, but then as soon as COVID ended,
Did it?
they
You
came
came
right
back?
back.
I'm
Right.
glad to hear
So
that.
but I'm speaking more generally about where do people go for services, and maybe
Right.
might this be paired with where people go for
Right.
services.
I mean, that's why I thought of 325. You have, an audience there that cycles through that building.
Does it have to be an interior space?
Oh, no, this goes outdoors.
So it's protected from weather.
Yes, it's a weatherproof vending
Okay.
machine.
Can we get back to you next month?
Absolutely, yeah, there's no pressure on this, other than I believe the deadline for opting in or out for the free,
It's tomorrow.
no, August. August.
Of course.
So we have time.
Okay.
But just something to think about. And just lastly, another thought that I had was the 7th Street Park, which I talked to the mayor about that. He informed me that the 7th Street Park is about to undergo a renovation. So again, I don't know how that would be received if we, renovate it. But I can assure you, the individuals that frequent the 7th Street Park, renovation or not, will be frequenting it, again. So, to have something like this there, I think doesn't detract from a beautiful park. In fact, from my lens, it enhances it, but that's just me.
Oh, that's a big gift.
Are these ever co-located at a medical facility or in around a medical
They could,
facility?
yes, they could be that, and
Or the jail.
the jail, I don't want to put the commissioner on the hot seat, but social services, and anywhere where, masses gather.
Near the emergency room?
Sure.
That's what I'm thinking. When I think about this, that's where I would.
Right.
I don't know if you could go in the hospital and just pick
Right.
one up without paperwork.
Right. The push to get Narcan and xylazine and fentanyl strips is really prevalent. I mean, I remember 10 or so years ago when we did the first training for Narcan, it was very restrictive. It was for providers only. And that was A for effort, but kind of a C or D for execution, because we were putting it in the hands of providers. You need to put it in the hands of the people that are using the products that, need to test it or who are at risk for overdosing. We've gotten a lot better and it's more free flowing. There's Narcan everywhere, as well as xylazine and fentanyl test strips.
Well, we appreciate your diplomacy and not wanting to cast aspersions on any potential location, so the committee can masticate on
All
that.
right,
and
I'll bring it up
reconvene.
next
I'll
month.
send,
Thank
I'll
you.
send this out.
Yes, and you'll have more.
Chew on
comments.
I feel like I'm in an SAT.
Really? We're smart enough to be here.
All right, were there any further questions for Director Almasi before? Thank you, sir. Great report. All right, Supervisor Committee's resolution. So everyone the Board of Supervisors, were aware of this, but for the public, that's the Supervisor Michael Chimides brought to the Columbia County Board of Supervisors' attention threats to Medicaid. So sir, take it away.
Yeah, thanks for having me. So it's, as I sort of emailed into the resolution, just a huge portion of our county uses Medicaid to get their healthcare. So what is it? It's 31.7% of our residents, and it's 41.6% of our children get Medicaid, or use Medicaid. Medicaid also provides all these really essential services in the county. Not only does it provide healthcare for children, it also provides long-term care, mental health services, treatment for opioid addiction, school nurses, services for kids with disabilities in schools. So it's a really foundational element of how people get what they need. And there's a lot of concerns about changes to the program that could happen this year, whether it's sort of changing the requirements of who is eligible, thereby knocking people off, or significant decreases to funding. I emailed everybody 2 links from the National Association of Counties, sort of flagging some ways that this could go down. And there's a lot of things at risk. So I think we're the best off by sort of just getting ahead of the game and telling our residents and telling our New York State delegation, look, Medicaid is really important. We're passing a resolution in favor of Medicaid. When I had brought this up last week at the full board meeting, a few people had come to me afterwards suggesting that maybe we should add some of the other essential programs that are potentially at risk. So there's that, like the last whereas section to sort of list some of the things that I sort of see as big priorities for our county that could also be at risk, which is the SNAP program, Meals on Wheels, food banks, school purchases for local food, small business loans, transportation and transportation infrastructure, things like roads and bridges, and then this like various support for farmers, which includes the REAP program and the EKIT program. I'm sure we could add a bunch of things to that. We also, I guess if people disagree with those, we could also take some things out. But I thought this is like sort of our best way of showing a unified front that we need these programs for our community.
And you mentioned the vulnerability of the local our-only hospital.
Yes, right. Thank you.
All right, everyone's read through the resolution. Do I have a motion?
Last one to add, I had a lot of conversations with Mike about this. I wholeheartedly agree with the program. And in talking about it, I had explored the idea of what the actual relationship between the funds would be in terms of the percentages for the county. So I just prepared this some additional documentation that might be helpful in looking at, I think it's some approximate numbers on.
I love it when supervisors bring educational material.
Yeah,
This is great. Two in one setting.
The top just really talks about how I arrived at the numbers, and then the bottom really just, the highlight is that the county's percentage of, well, that the federal percentage of the Medicaid is actually very, very high, and how catastrophic it would be if that were cut, and which underscores what Mike is talking about, the impact it would have on our county, and I think the importance of this resolution.
So Chairman, if I might offer a comment, I certainly agree that the federal funding that supports Medicaid and a number of our federal programs is important. However, I'm not opposed to somebody restructuring it, so trying and provide it where it's most importantly needed. So trying to just say never cut anything sounds too firm to me. I think that, I mean, Rob brought up some points earlier, and this information actually brings up to the point that maybe we've got too many people relying on Medicaid. Our real goal is to get them off of Medicaid and back into functioning. And so if there's a program that reduces some of that and moves it around, I'm not opposed to that. So keeping the wording just a little bit open-minded would be a suggestion from me, but I didn't propose any exact wording, but I just thought I'd bring that up for conversation. Like I say, I'm not against getting it together and saying to our representatives that we don't, none of us want to lose it. We have a lot of important programs that support a lot of our community, and it's very needed. But yes, it has to be reprioritized. I'm not opposed to that.
And I don't, to your point, I've reread the resolution. I don't find this overly restrictive. So, and you said you didn't oppose any of the specific language. I think it's fairly general in terms of its opposition. And, but I think if there is a discomfort with some of the language, I'd like to identify what that language is. Because I'm hoping that we're going to move this out of committee today.
When the state was cutting funding, did we do a similar resolution?
We did do a resolution criticizing, or like, I can't remember who was
Well, I mean,
criticizing, but
similar. I mean,
yes.
We actually did a resolution asking for a cost shift because we're one of the 2 states in the whole country where it's passed on to the county. And what we had said, the state should be paying for this. So what I'm concerned about, and I talked to Brenda about it earlier, is the fact that if the state gets cut, they're going to try to cost shift the cuts down to the counties. We don't want that to happen either, because as you know, we're not in that position to be able to absorb that.
Right, so we're actually more, as a county, we're more vulnerable to shifts than most counties in the country.
Right.
And then that might, because this is targeted toward the national congressmen and senators, it might mean that we need to do another resolution for our local state authorities, just to reiterate that point.
A deeper thought, or I don't know the answer to this, so I'm going to bring it up, is that let's just say that the federal government cuts, goes to the state cuts, comes back to us, and we don't have the funding. What happens?
Yeah,
I mean, are we obligated? Are we legally bound to provide? In other words, if it's thrown in our laps, what does that look like?
I think it depends on how they cut it, whether they change eligibility.
To Bob's point, we don't know what they're, could potentially cut.
Right. I mean, there's a lot of, we don't know anything. There's a lot of what ifs. I'm just curious, what if, it all of a sudden costs the county $5 million, what happens?
Yeah, I mean, again, to me, it seems like there's 2 potential bad scenarios, which is one is that we're obligated to pay for something that we can't afford, or people who need health insurance are unable to get it and no one pays for it. And either one of those scenarios could be pretty detrimental to the well-being of our county, but also just because the hospital is the major employer, and it's so dependent on funding, is that any sort of significant changes to who is eligible in the county could also disrupt our largest employer. So to me, all those things speak to, yes, we start thinking about how to prepare for that. But the first thing is to be like, let's not enter that catastrophic scenario and let's avoid it.
Because the hospital would be required to still provide care.
Yes.
No one would pay for it.
Correct.
And that would make their deficits.
And there's a lot of business.
And I think,
Exactly.
I think we've been really concerned about the long-term survival of our local hospital in any event, and this could be the straw that breaks the camel's back, basically.
But we too have done budgets where we've said this is a limited amount of money we've got to spend and we have to prioritize it. And those are challenges. That's all I'm saying. If we could just look at a line that says, when it says to not to oppose any regulations, could we say any required reductions or reasonable reductions? If there's just a little word in there that
That's the line I'm looking
Maybe
at.
just
too.
eliminate any and say to oppose reductions or to replace any.
Oppose, we don't want to, we don't want to oppose,
Any reductions in funding.
well. any
That's the line
reductions-
that I'm looking at.
Yeah,
I
that's
think
the one
Brenda's
that-
suggestion is fine, we just, if you delete any.
any reductions.
Where
The
are
first
we? Where is
resolve.
everything?
First
The
resolve.
first
Yeah.
resolve.
US, United States
To
Senate
oppose
to
any
oppose,
reductions in
get rid of any reductions in funding to Medicaid or
Yeah,
changes
That
in
would,
Medicare that
you
would.
know, and that would
reduce services.
restrict eligibility
I'm
or,
almost a little on the fence with the restricted eligibility too.
because that might be a requirement, you know. You could
Reduce
say
services or shift costs to local governments, I'm fine with.
Is it okay, just as Commissioner, if I weigh in a little bit?
Sure, thank you.
Just to give the perspective of administrators, and I think what you're discussing is all very good. You know, if you're wondering on the ground, where is the concern? It's being caught flat-footed.
Exactly.
So it's being caught where, it's the unknown that's giving us such anxiety right now. And, you know, I don't know if people are aware of the county's weekly share, but it's quite high. It's in excess of $200,000. That's a weekly share.
At the current rate.
Yes, and we're barely holding that up. And so I am very fiscally concerned, but as an administrator, I am concerned about the users. And if everybody's not at the table, at the time when they're discussing these things, it's a domino effect. So I think that the federal government can't be thinking about these things, supervisors, without the states and the counties being
At the table.
present.
Right,
Because
yeah.
it's a house of cards.
Right. And I don't think anybody's ever talked about cutting it all, but to your point, I think there should be a communication before any reduction is made, or any change.
Well, a discussion.
Right.
They can tell you they're gonna do it, they do it, we did it.
Right.
If this would work, take out the word any reduction in funding to Medicaid or changes to Medicaid requirements that would reduce necessary services,
Yeah, that would be good.
restrict eligibility, or shift costs to local governments.
I could be good with that.
Yeah, basically, you start taking out any and adding necessary.
Yeah.
Yeah, makes sense.
And just to your point, Ron, I think unfortunately, this information is communicated, but it's generally communicated at the time that the decision has been made. And that's too late for us. And that's when we're
I'm saying
vulnerable.
we put a statement in there without allowing local government a chance to,
Right.
They won't even allow New York State to come to the table, so,
we our next budget cycle, so we can.
Well, I'll be honest,
We're
that
not the federal
playground
government, we can't just
resolution
say
I
money.
bring in front of my town board on Thursday to encourage
You're
the
gonna do
county
the
board of
same thing.
supervisors to encourage the delegates, that, it's getting the local word out.
So, I just want to add one other thing, just take out of Bob, is reading from this NACO letter. NACO says that sort of any changing to requirements is going to disrupt. NACO's position is sort of, you actually want the states to be flexible.
Right.
So if the federal government adds in sort of they do use this word of like any requirements is going to disrupt, because they're like, we would rather the state and local governments have the flexibility of figuring this out, and that you just don't want it coming from up top. So I can quote from their letter that it's, I guess, just to sort of couch my positioning of being like the position I'm putting forward matches NACO. But I also agree with the changes that you recommended around any necessary.
And I think it is a house of cards. That's basically what they're saying. It's a very.
Oh, yeah. I think we all recognize that.
So I,
Well, but the other thing, if you just go as deemed necessary, I mean, by who? I mean, I think you got to put a qualifier. I mean, there's some people don't think it's necessary, as deemed by best practices, or, you have.
No, the federal government should be communicating with the states and the local providers, to get there, not providers.
let's think about the audience. It's going to our state, to our senators and our Congress.
Right,
people.
right.
So if they're the people that are going to be.
They know how to do it.
Right, they're going to be part of this decision making.
Yeah. We're trying to get their attention, that's all.
So I'd like to move this as amended unless there's any further discussion.
All right, second.
Second. Motion and second. Any further discussion? Thank you Supervisor Shamiz for bringing this to everyone's
Yeah.
attention and for offering this. So we really appreciate it. All in favor?
Aye.
Opposed? Carried.
Thank you so much.
Thank you.
Thank you, Michael.
And thank you, Randall, for and thank you for the 200K a week. That will keep me awake tonight.
He's probably every night.
Yeah, right.
207,800 per week.
Okay,
Okay.
207,800. All right, that deals with all of our business. Do we have any questions from the public?
I just wanted to say one more thing about Michael's resolution. I think if we're talking to our delegations at all, the other thing that we might emphasize is that any mid-year corrections are especially damaging. You know,
Right.
it's one, for planning for another budget year, that's one thing, but a mid-year correction.
Well, I think that's to Bob's point is, that, you know,
That's
how do you
where I
react
was
in
at.
30 days?
Give us a chance to have an opportunity, don't say, okay, effective July 31st, this is what's gonna be.
I think we all recognize
You know,
there's some changes that may be
Say,
needed, but
you
you have
know,
to
effective
approach it.
January 1st, 2026, gives them an opportunity to adjust for what trying.
I just didn't want to load up your resolution, but I just wanted to make sure that you understood that
Right.
those conversations are timely.
Absolutely.
Anything else from the supervisors?
No.
Anything from the public? Well, thank you all for joining us today. It was a lively and educational experience as always. I'm gonna ask for a motion to adjourn.
Motion to adjourn.
Second.
All in favor?
Aye.
Thank you, everyone.